Hi, my name's Kiana Kadinger. This is my driver's license, and this is my face. I'm going to just kind of talk about how I put my presentation together about childhood depression. All right, here are my objectives. I'm going to talk about how I chose my topic, how I chose who I was going to present to, how I gathered the information necessary, and how I evaluated how effective the presentation was. Okay, well, to start out, Healthy People 2020, 2030, one of the things that they said was a huge concern was mental health in children. Um, and so before I became a nurse, I spent a lot of time, I worked in mental health as a tech for several years, and I gained a lot of um, appreciation for mental health, especially in adolescents and children. I also have a 13-year-old son who is going through a time where he is interacting with a lot of his friends are not only depressed, but are even having thoughts of suicide or self-harm. So we encourage him to talk to us a lot about his feelings and how he feels about his friends' feelings. And then I also have a 4-year-old daughter who gives us very good examples of how children her age act. And I'm have a very good understanding of how those differences are very small and sometimes hard to see. Okay, so reviewing examining the community, I see that mental health is lacking. Behavioral health and substance abuse are the number first and second, excuse me, first and third um, issues and concerns in mental health in the healthcare field. And they were already an issue, and then once COVID came around, the issues increased. Um, the issues increased because more people were having issues with their mental health after being isolated for so long. And then also a lot of the people who were providing mental health would either go elsewhere outside of the community and do their work, or would just stop doing the work altogether. So I kind of had to look into what kind of things need to be presented and what kind of things need to be done. Um, so, um, I had to look into early intervention. Early intervention is important and has been shown to be important in bigger issues such as depression and anxiety. So um, now other diagnosis like schizophrenia or bipolar disorder, it's not as helpful, and it's also not um, as pertinent because there are very few diagnostic um, symptoms that occur before early adulthood. So, okay. All right. So, most of the research as you see on behavioral health and depression is focused on 12 years old, children who are 12 years or older. So there's not nearly as much that applies to children who are younger than 12, which is kind of more what I wanted to focus on. So, in order to get a good view of all the issues that were out there, I kind of broadened my horizons to all of the mood disorders, which were including anxiety and disruptive mood dysregulation disorder. Um, Treatment of these mood disorders in children are sometimes more difficult because there is less research out there about it, and there's also less information out there. But and then marriage and family therapists are the ideal therapist to handle these situations. Unfortunately, there's not a lot of them out there. Okay, so choosing a site. Choosing a site, I needed a place where there were children, a wide range of children. So again, I used my child, my daughter, who's 4, is had just recently started preschool, but before that went to daycare. She returned to her daycare for summer camp this last year, and which helped me just kind of look at it from a different perspective. So I chose this site because there's such a wide range of children in ages and backgrounds. And These children spend a lot of time in their daycare. So these people see these children most of the time, they see them all day, 5 days a week. So it gives them an opportunity to get a regular, consistent um, insight into these children's behavior. So next, I had to kind of gather the information that I needed and figure out what this particular audience would need to know. So, I kind of had to look into how am I going to teach these adults. This is a group of adults who are college educated. Most of them are well into their careers. Um, so I needed to find the most effective way to do it in the time frame that I had. So one of the things that I did during this presentation was I asked them for their experiences. I asked them what did they already know about childhood depression, because surprisingly, a lot of people know more than they realize that they know. Um, I also knew that I had to be careful not to just read to them, because in order to retain the information, adult learners need to be engaged. Also wanted to make sure they had great resources to go back and get more information, or receive the information if they needed to. Okay, so the best way, just kind of talking about the best way to teach a little bit more information about that is, so there's a potential versus kinetic information. Potential information is pretty much all the information that's out there. And Kinetic information is the information that we actually use. So, of course, I want this information to be that kinetic information. I wanted it to be the kind of information that they could use. So I had to be very specific and to what kind of things they would see in their environment, and make sure that I gave them lots of examples and um, use visual cues to make sure that it was something that they would retain and remember and be able to use when the time came. So I had to find a place, a situation where it was going to be comfortable for this presentation. I will say that my end goal is that the facility has preset dates for education, where people come in, the school is closed for that day and they come in and they do their education. Because of the time frame, I was not able to actually do my presentation in that particular setting, or that particular time, because it's after that time will be afterwards. So I plan on actually doing the presentation again at that time so that I could include more people. I was able to do it for a small audience um, here at the facility after hours, because I needed to make sure that it was in a situation where there was no distractions, which if you have children or been around children, they are distractions. So I needed to be when their children were not there and where they were comfortable. I provided snacks, and made sure that that beverages were available. All of the things to make sure that it was going to be a good learning environment. And then I used a PowerPoint presentation so that there was not only auditory information presented to them, but visual information. And then I even gave them some handouts so that they could go home. I gave them resources so that they could get more information later if they wanted to. Um, So that was pretty much that part. Um, and then in the end, I had to be able to evaluate the, sorry about that. I had to be able to evaluate the presentation that I was given. And so that's something that I will do as time goes on. So I did like a brief assessment at the end of the presentation, just kind of um, what have you learned? How do you think this will be helpful for you? How do you think this applies to your job and what you're seeing? Um, but then I also will go back in 6 months and a year and just talk to them and get actual examples of how they were able to use the information that I was giving them, if they saw any of children with the behaviors, and what they did, what they were able to do with that information. Also, give them the opportunity to ask questions that they may not have had originally, because now they've actually had time to apply the information that I gave them. So, um, I'm very excited about this, because I think this is definitely something that is very necessary. Um, just because I think a lot of children kind of get slipped through the cracks because they don't understand, that we don't understand what's actually going on. So I'm hoping that this will be beneficial to them, and maybe someday it'll be something that can go even to a broader audience. Thank you very much.